I am Dr. Sharjeel and today I would like to tell you about the evolution of the cataract surgery. Cataract surgery is one of the most common procedures performed worldwide and crystalline lens. It consists of capsule, lens epithelium, cortex, nucleus. Cataract is an opacification of the crystalline lens. Today I would like to tell you about the evolution of the cataract surgery. The earliest method dates back to 5th century before Christ, known as couching. Couching is performed on mature cataracts with a special needle. Cataract was purposefully dislodged out of the visual axis into the vitreous cavity. But there were a lot of complications associated with couching. There was inflammation, high rate of retinal detachment, macular edema. So the visual improvement was not long lasting. Then came the intracapsular cataract extraction, or ICCE. With large corneal incision, the whole lens along with the capsule was removed and 5 to 7 stitches applied. But there were also high rate of complications. Complications associated were corneal decompensation, vitreous prolapse, retinal detachment, and macular edema. The mechanism by which the granules were broken has evolved from the early use of forceps to hold the lens capsule and manually disrupt the granules to the cryo extraction. When the frozen probe is applied to the capsule, it adheres to the cataract capsule and then it is gently removed from the eye. Then came the most successful extracapsular cataract extraction, in which the major portion of the capsule is left in space. Anterior capsulotomy is done and IOL is placed inside the ciliary sulcus. So the patients got rid of the large aphakic spectacles that they have to wear after intracapsular cataract extraction. Wound becomes smaller, stitches less, the visual recovery time decreased. Then came the small incision cataract surgery, in which 2 mm above the limbus into the scleroconjunctiva, straight or curved incision was given. Scleral tunnel was formed into the anterior chamber and the lens was removed through this tunnel, and only one stitch was sufficient due to highly vascular sclera and conjunctiva. But this procedure was associated with higher rates of high FEMA, high astigmatism, iris damage. So that was also discarded. And then in the 1967, Charles Kellman, an American ophthalmologist, introduced phacoemulsification. In this technique, the lens is emulsified with a machine and foldable intraocular lens is implanted through very small 3 mm port, and it's a sutureless surgery. So now the patients got rid of sutures. They have to go back to the doctor for removal of those stitches. Complications were markedly reduced, a very rapid visual rehabilitation, less surgical time. So now that conventional phacoemulsification has been replaced by the femtosecond emulsification, in which most of the steps are performed by the machine, like the wound construction, like the anterior capsulorhexis, like the phacofragmentation. These are all done by the femtosecond laser. So now the chances of human error are also decreased. Thank you very much.